Let's Get Real is important because it provides a platform for services to analyse their service delivery, also the level of competencies within their service and within their teams, and how they perform and how they deliver effective mental health and addiction services. First we had a leaders and managers workshop for all the managers in NGOs in MidCentral District. Then we had 4 workshops for practitioners, and we had about 150 practitioners that attended those workshops, and those workshops were dedicated around values and attitudes for Let's Get Real. I think it was a reminder for practitioners that their basic skills such as empathy and listening and those sorts of attributes are really important, and that they're quite key in terms of engaging with a client and that therapeutic alliance. I think having coordinated several of the workshops with Te Pou, it provided a platform for managers and for practitioners to look at their own skill sets and what's needed within their own organisations and where they're at and where they need to get to in terms of effective mental health and addiction service delivery. The Let's Get Real framework has been very useful in terms of my role as portfolio manager, because it's provided a concise framework in terms of identifying what the needs are, what the organisational needs are around competent workforce delivery. We identified values and attitudes workshop as a necessity, as basically values and attitudes underpin the entire Let's Get Real framework. Basically, the Let's Get Real framework has provided a concise framework in terms of the areas that need improvement within an organisation and where that organisation needs to be in terms of its long-term vision around workforce development. It also provides the opportunity to create measures and outcomes around a competent mental health and addiction workforce. Well, in terms of mental health and addiction services working with clients one-on-one, this framework would assist communities in terms of how those people then go back and live in their communities and exist in their communities, so that they're supported and that they have their own tools and strategies themselves to look after themselves and keep themselves well. That has a flow-on effect to the communities that they live in. I think the biggest strength is that it links to professional development bodies in terms of DAPANS and ANZSW, and so it's quite applicable across the different disciplines from social work, psychiatry, nursing and psychology. I think the benefits of the workshop from the Values and Attitudes workshop were that practitioners were able to reflect on their own skill base and how applicable those really are in terms of enhancing that therapeutic alliance with the families and clients that they work alongside. It's important for practitioners to have the right values and attitudes to increase the engagement in working with families and identifying the potential within families, and for them to take responsibility around their wellbeing and recovery. I would say that Let's Get Real is a concise framework that's a great tool for enhancing best practice and clinical outcomes.